Hi, in today's scenario we have an 18-year-old post-left partial meniscectomy and repair presenting with decreased strength in knee extension. Our patient utilizes a partial weight-bearing status with crutches for mobility. The goal with our PT today is to intervene and increase strength with the use of the NMES system, neuromuscular electrical stimulation.
Alright, we're just checking the unit to make sure it is in working condition. So we'll flip up the top, it turns on. We're also going to check the wires, make sure we don't have any kind of fraying, make sure they're good, and it looks like they are fine.
The parameters we've chosen for this intervention is a frequency of 35 Hz and a pulse width of 300. Ramp on time is 2 seconds, ramp off time is 2 seconds, held for 10 seconds, and off for 30. And the reason we chose these parameters was to obtain a motor response, and this is achieved with a low frequency and high pulse width for more E-Stim to the muscle.
Hi Kyle, my name is Andy. I'm a student physical therapist assistant. I'm going to be working with you today. Is that alright?
Yeah, that's fine.
Okay. I understand that you recently had a meniscus repair on your left knee.
That's correct, yeah.
How's it been feeling?
It's painful.
Okay. And on a scale of 0 to 10, what kind of pain are you feeling today?
Between 5 and 6, depends on,
Okay. Well, let's go ahead and have a look at that knee. If you want to get up here on the table.
Okay.
Is that okay if I take a look at that and touch your knee?
Uh-huh.
Okay. First, let's actually have you lift the right leg. Let's see what kind of motion you have with that one. Okay, good. And the left one then? Not as much, huh? Okay, that's what we need to work on then. Let's look at that. Okay, I'm going to go ahead and touch you.
Okay.
Can you feel this here?
Yep.
Okay, right here. Okay, so you've got some good sensation in there. And visually it looks good. I don't see any kind of infections, no skin issues here. Are you currently seeing a doctor for anything else?
Nope.
Nothing? Okay, you don't have any pacemaker or any kind of metal implants?
Nope.
Okay. Also with a woman, you'd have to check, see if they're pregnant. So what the physical therapist has asked us to do today is to apply some electrical stimulation. What we're looking to do is to help prevent atrophy and also to strengthen the muscles in that leg so you can get some more extension out of it. Alright?
Okay, Dymond, what we're going to do is I'm going to clean up your leg here so we can get the electrodes to stick well. Is that alright?
Yeah.
Okay. Then what we're going to do is we're going to just stick these on your unaffected leg. It's just so you can get the feeling. And then what we'll do is we'll continue with your treatment and go to the other leg. Is that okay?
Yeah.
Okay. Alright. Okay. Can you flex your leg for me? Perfect. Alright. So, let me just show you the machine really quick so we can show you.
Okay.
Okay, so this is your intensity right here. So
Okay.
what we'll do is we'll start your intensity. This little thing right here.
Looks like a heart rate thing.
Yeah.
What is it?
What it is it's just saying it's symmetrical. What it's going to do is it's going to cover a big group of muscles rather than just a small group.
Oh, okay.
Okay? So let's set you up here. You tell me when you can start feeling it.
I can feel it already.
Okay, that's good. There you go.
Oh. That feels funny.
Okay, so what it's going to do is it's going to be on for 10 seconds. It's going to go off for 30. Does that feel okay? Is there any pain or anything? You
No.
should just feel a muscle contraction.
Yeah, I got it to tighten up.
Okay.
And then we're going to do it over on this side?
Yep, so what we'll do is we'll switch it over and go to that leg.
Okay.
Alright, Annie, so now we're going to do it on your involved leg, okay?
Okay.
We're going to get this thing firing up. We want to get that extension. So I'm just going to set you up real quick. Tear this open. Just clean up that leg. want some good contact here, so we don't want it dirty. Look pretty clean as it is. Can I hack this up just a hair for me? Perfect. And in situations like this, we might trim the hair just a little bit too to affect any contact to make sure we get as much as we can. So let's see how can we do so far. Try to straighten out your leg for me. Okay, go ahead and relax. That's perfect. I can feel just a little bit there. And I can actually see right here, so we're okay. So what you're gonna feel, Andy, is when I turn this on, you're gonna feel a little bit of intensity go in there, okay? And then it's going to start to come up a little bit. We call it a ramp. Okay. At the time you feel it, this is one of those things you work with it. So when it comes on, you're gonna turn your muscle on. You're gonna try to straighten your knee out as much as you can with it. Okay.
All right.
When it turns off and goes off for a second, you're gonna relax with it too. Okay.
Okay.
So it's one of those you work with the machines. Okay. Just get you started here. You ready? So first off, just let me know when you feel it, okay, bud?
Yeah, I can feel a little bit.
Okay. Anything yet?
Still feel it went off.
There. It's a pretty solid contraction there.
Yeah, it's pretty good.
Okay.
And that's when you want me to try to straighten my leg.
Right, so as it goes, you work with it. Looks like it's kind of pausing for a sec. Is that what you're feeling?
Uh-huh.
See how they're kind of flashing there?
Uh-huh.
You're going to see it drop and it's going to start to build up. That's what we call the ramp. Here it comes.
I can feel it.
Work with it. Try to straighten it out. Good. Remember, we're going on for 10, off for 30, so it's going to be 10 seconds of good solid hold, trying to straighten that knee out and then resting for 30, okay?
Okay.
I'm going to set this here. Got a timer here set for you. Okay. I'm going to set that just right here where you can see it, okay?
All right.
15 minutes is what we're going for. Here's a little timer if you need anything, okay?
I'm so glad you're here.
All right.
Great.
Just press this little button right there if you need anything, okay?
All right. Sounds good.
Corresponds with mine, so if you press that, I'll know you need something. I'm just going to be right around the corner, okay?
All right.
I'll see you in 15.
Thank you.
All right. So we're all set? You feel good, right?
Yeah.
Okay. Everything on here is preset, okay? So don't try to change anything. It's set just how it should be, okay? I'm just gonna rest it right here, but I don't need you to fudge with it or anything with it, okay?
All right.
It's perfectly fine. If you need anything, if you feel like it's too high or anything, just press that button. All right. I'll clean up. Need a glass of water or anything real quick?
I'm good, thank you.
All right. All right, bud. How we feeling?
Pretty good.
Yeah.
Yeah.
Wasn't too intense, but comfortable.
Nope.
There we go. 15 minutes is up. All right, we'll kill that. Kill the timer. Let me lower the intensity real quick before I turn this off, just to make sure we're all set. Shouldn't feel anything at this point. Good?
I don't.
Okay, perfect. I'll have you remove that one there. Didn't want to rip your hairs off there, bud. You okay here?
Uh-huh.
Okay. From the top, very good. Thank you. All right, 1 second here. I just want to check everything out and make sure we're good, okay?
All right.
Can I see that upper spot there? I just want to make sure you didn't have any adverse reactions to the stim unit there. Everything looks okay there. No pain or tingling or anything when I press here, right?
No.
Okay. Perfect. All right, real quick. I'll have you return your position just off the side here where we were. Make your way off to the side just nice and easy here. Just right there is perfect, right? Just relaxing right there. Okay. So when we started the session today, I want to see how things were going there. We had you engage your right leg, and then we engaged your left leg. We've already can see what the right leg can do. I want to see how your left leg's doing now. So let's try to straighten it out a little bit there. Okay, looks like we're getting a little bit more extension there. No pain or anything when we do it?
No more than normal.
Okay, well we're just working on strengthening this muscle up. We want to get that extension, get those muscles strong as your meniscus heals back over there. Okay?
Okay.
All right, we'll get you up in weight bearing here hopefully sooner than later. But we gotta wait for that to heal. In the meantime, I'll grab your crutches right here and we'll be on our way.
All right.
All right.
Thank you.